We continue to see more and more countries trying to evacuate their citizens. We are seeing travel restrictions for 40 million Chinese people. The U.S. perhaps could consider flight bans from China. How successful will this be in trying to stop this outbreak when we know that the incubation period is up to 14 days?
So those measures are intended to stop exportation of infections maybe from some part of China into other countries. But we know it's very difficult to catch every infected person. Some people infected with this new coronavirus may have quite mild symptoms. Some may be incubating at the time they travel, so they don't show any symptoms when they land. It's only some days later that they develop symptoms. And then in order to catch that they're an infection, they need to go to see the doctor, say they've been from that part of China, and get tested, and so on. So it's a challenge, but it's a worthwhile effort to try and prevent the global spread of infections.
How does this virus and this outbreak compare to, say, SARS back in 2003?
It's really a different challenge to SARS. SARS came out of the blue, and it took quite some time to figure out the pathogen that was responsible and the best ways to control it. So in early 2003, cases started appearing in Hong Kong and then some other cities. And the epidemic really took off in March and then in April as well in some places. But once we figured out that most people who got SARS, almost everyone who got SARS was really ill, needed to go to hospital, and if we did the right things in the hospital, we could stop any onward transmission at that point, and that was sometime maybe March or April and then May of 2003. After that, we got the epidemics under control in all the affected cities, and it had gone by the summer in 2003. For this coronavirus, it's very difficult to think that the same approaches will work. We've seen many mild infections with the new virus, which is different to SARS, and we've seen transmission in the community because it's very difficult to isolate patients effectively. We haven't seen a lot of spread to healthcare workers, which was another characteristic of SARS. So it's really, I think it's going to be a real challenge to control this coronavirus, particularly if we only think about using the tools that were used during SARS.
The numbers of deaths and confirmed cases keeps jumping exponentially. How soon could we actually see the WHO step in and call this an international health emergency, something that they did not do last week?
Yeah, I'm sure they're thinking about it. I know the Director General of WHO is in Beijing right now, and I think that's a decision that he needs to think about very seriously within the next few days, because there are now reports of transmission occurring in other countries, even in other continents, and we're only seeing a part of the picture with this new coronavirus, because there are mild infections, and the infections that we are counting today are infections that occurred 1 or even 2 weeks ago because of the delays from infection to symptom onset and then from symptom onset to testing. So we're always behind. We're always trying to catch up with where this infection's going. And really need to take more serious measures to control it.
And this is one of the points that I was discussing with my former guest. We seem to be always reacting to all of these outbreaks, whether it's MERS or SARS or Ebola. What needs to be done globally to try to prevent this from happening and reacting faster in a global way?
We knew where SARS came from. It came from small mammals that were being sold for meat, so wild animals, mammals, being sold for meat in wet markets in China. And that practice did not stop. And we think that may have been the reason why the new coronavirus was able to spread into humans this time. And we've heard the Chinese government saying now they're going to stop the wild animal trade in wet markets in China in the future. And that's really good news for stopping future outbreaks of this type. For MERS, it's a different situation because MERS is infecting camels in the Middle East, and camels are the only animals that survive very easily in the desert. They need the camels, and the MERS virus is infecting the camels. So it's going to be difficult to stop ongoing sporadic outbreaks of MERS in that part of the world.